Yes. So, firstly, I'd like to congratulate the organizers for having the foresight to include me on the agenda today. Because unfortunately, as I've sat here throughout the day, it's clear to me that you guys have drank the Kool-Aid. Okay? Thankfully, you have me to show you the light and where we need to go. Okay? I'm sure most of you have already reviewed my bio on page 18, but there's certain aspects of this that you don't fully appreciate. Okay? And that's the 20 years of experience that I have as a specialist managing patients living with hepatitis C. Okay? So I realize you can probably almost get that level of knowledge by doing a couple of hours of telemedicine, Hep C training per week. But perhaps I digress. Okay. I always like to think of what Shakespeare would say at a time like this. Okay? He would say, "Hear you, Dr. Bruneau, what is the reason that you use me thus? I love you ever, but it is no matter, like, let Hercules himself do what he may, the cat will mew and the dog will have his day." So, it wasn't meant literally, but we live in a very permissive era. Okay? No longer do we recognize the expertise that experts have in a field. So if you ask Dr. Bruneau, it's all right to have non-experienced pilots flying very technically advanced spacecraft. Anybody can do it. What the heck? Okay? You don't need any special expertise to operate a ship. Okay? And in the field of medicine, anybody can do it. You don't need to be a psychiatrist. So Dr. Bruneau is going to tell you that anybody can manage hepatitis C, because it's just so obvious that you can just a couple of teleconferences a week, you'll get a pretty good idea of how to do it, and there you go. I'm here to try and convince you otherwise. Okay? So let's travel back in time a little bit, using HIV as an example of how this has gone. Okay? Poor management of HIV in the community. Okay? And this was a paper not published in a big specialist journal. It's the British Journal of General Practice, okay? Which I read faithfully every week. Okay. Barriers to GPs' involvement in managing patients with HIV. Okay? Uncertainty over how to identify other illnesses from HIV. Ooh, isn't that a difficulty? Is it HIV? Is it lung disease? Is it heart disease? I don't know. Jeez, this is so complicated. Okay. Okay. Complexity of heart regimens, their interactions, and their side effects. Well, geez, there's no similarities with hepatitis C therapy there. Thank goodness, because there's Hep C therapies are not complicated. There's no drug-drug interactions, and there's certainly no side effects. So that probably doesn't apply to hepatitis C. Lack of time, experience, and training. Okay? So this is what your colleagues are saying, Dr. Bruneau. Okay? Compared to infectious disease physicians, the likelihood of patients being treated is about 0.3, an odds ratio of 0.3 of being on heart if you are a non-expert general physician. Okay? Patients being treated by low-volume physicians are much less likely to be on heart therapy compared to those treated by high-volume physicians. Okay? poor management of HIV in the community, training in infectious diseases and HIV experience were associated with the use of appropriate antiretroviral regimens, and controlling for experience, ID physicians were more likely to choose appropriate antiretroviral therapy. Okay? Providers with high HIV caseloads were early adopters of complex antiretroviral regimens. Okay? So this work suggests that with an infection similar to hepatitis C, your level of expertise really does matter. Okay? But that's only one disease. Okay? Let's talk about other fields of medicine. No, I was as shocked as everyone else was when I. But, I suppose Dr. Bruneau has some out there ideas about how we should practice medicine, and I guess maybe cigarettes are making a comeback. Okay? So, I looked at the literature on oncology management in the community. And in this paper, published in Cancer, they stated that only 24% of primary care providers met criteria for routinely providing multi-dimensional survivorship care. Okay? So I don't even know what that is. Okay? But that's why I don't treat cancers. 47% of primary care providers cited inadequate preparation and lack of formal training in cancer survivorship as problems when delivering care to long-term survivors. Okay? The results underscore the need for substantially increased training, maybe to the level of a specialist, in survivorship care to support the delivery of multidimensional primary care for long-term survivors. Okay. Well, let's talk about liver disease. And now it just becomes surreal. Animal companions, animal doctors, animal people, what are you advocating for? There she is in the middle. Will it ever stop? So they looked at management of liver disease in the community. Hepatitis C is a liver disease, by the way, in case you weren't familiar with that. Okay. A study comparing the patterns of evaluation and management of chronic hepatitis B between primary care providers and specialists according to the professional guidelines. Okay? And looking at hepatitis B. Only a third of hepatitis B patients managed by primary care providers had adequate evaluation of E antigen status, hepatitis B DNA levels, and liver enzymes. Okay? Geez, thank goodness hepatitis C doesn't have any issues like that. Patients seen by primary care providers were more likely to be given older drugs, and they use lamivudine as an example. Okay? So I guess if you're in the pharmaceutical industry with hepatitis C, you're happy because consensus interferon is making a comeback. Okay? And here's just a graph demonstrating the much higher compliance with guidelines among specialists compared to primary care providers. Okay? So the study suggests that hepatitis B awareness promotion to primary care providers and high-risk populations, as well as appropriate referral to specialists, is needed to increase adequate evaluation of hepatitis B patients. Okay? Due to their increasing complexity of hepatitis B, a more focused visit at a specialty clinic may be warranted to appropriately address hepatitis B, since specialists will be less likely to be distracted by other important health issues. Okay? And I don't want you to be distracted from the more important health issues. Okay? There's a high level of hepatitis C expertise that's required to provide care. And that's certainly a true statement today with the difficult medications that we use. But for those of you who think that this is going to change in the near future, I think you're incorrect. There will be drug-drug interactions, there's resistance issues, adherence issues, cost containment concerns, and direct-acting antiviral misuse. Okay? which I'm going to focus on. Let's have a look at another example of how important medications are used and misused. That, of course, is antibiotic misuse by non-experts. Okay? This was an evaluation looking at the antibiotic misuse by non-experts. They looked in the hospital, 190 million defined daily doses of antibiotics, and they suggested that in the hospitals, 25 to 45 of those were inappropriate and unnecessary. In the community, 145 million courses annually, 20 to 50% were deemed inappropriate. Okay? These antibiotics are relatively inexpensive. We can't afford to have this level of misuse of these very expensive hepatitis C medications in the community. They need to be the use needs to be restricted to those people who really know the medications. Okay. Millions of times each year, physicians, regardless of specialties, prescribe antibiotics inappropriately. A survey of primary care physicians found that the most common factors leading to increased antibiotic prescriptions in patients was if the patients just asked for the drugs. Okay, well, that shouldn't really be a criteria for deciding whether to prescribe or not. And the physician's diagnostic uncertainty. Okay. Finally, and this is what I expect you'll fall back to, okay, is, well, patients don't like going to hospitals. They don't like seeing specialists. Okay? Well, I have to ask you, is that what the patients say, or is that the message that they're getting from the primary care clinics? That, oh, you don't like those hospitals. They're bad there. You better stay here. Now, let's be honest. Because my experience is that our patients who come from all walks of life, from the inner core of Ottawa, from the rural areas of Ottawa, of Eastern Ontario, Western Quebec, Nunavut, are very happy to be there. Okay? They see that they have a caring, knowledgeable team there that is willing to serve and do whatever it takes to get them engaged in care and possibly treatment. And that's what they're looking for. And I don't think they care where it happens. So in conclusion, these are complex disease management, or it's a complex disease that require a high caliber of expertise. Okay? Hepatitis C regimens are too complex and they're too expensive to allow for mismanagement. Patients want good care and they don't really care where it happens. Okay? Now I look forward to my esteemed colleagues' response to this. Thank you very much.